This is our antibiotic presentation on Piperacillin by Ariel Vicara, Nicole Selinsky, and Marissa Kowaleski. So what is Piperacillin? It's a relatively low-cost, generic, penicillin-based antibiotic that was patented in 1974 and approved for medical use in 1981. The World Health Organization has classified piperacillin as critically important for human medicine. It is used in combination with another pharmaceutical drug known as tazobactam, which inhibits the action of bacterial beta-lactamases, which we'll talk about a little later. Some uses of piperacillin. It's often used to treat serious hospital-acquired bacterial infections, such as neurotropenic sepsis, which is an infection that develops in someone with neutropenia, which is an abnormally low number of neutrophil granulocytes, which is a type of white blood cell, multi-drug resistant pneumonia, and various other internal infections mainly caused by bacteria in the genus Pseudomonas aeruginosa, which is a gram-negative aerobic bacteria that is resistant to multiple drug treatments. So this can include things such as animal bites, bone and joint infections, gynecological infections, or lower respiratory tract infections. When it comes to administration of piperacillin, unlike many other antibiotics, it cannot be absorbed orally. So this is good for SpongeBob over here, who does not seem to like the taste of the pill he just took. Piperacillin must be given through either IV or intramuscular injection. Studies have shown that piperacillin is concentration independent, which means that giving more of the drug does not increase its efficacy. Instead, it shows higher bactericidal activity when it's given over a longer period of time. The max recommended dosage is 4.5 grams every 6 hours for infants and 4.5 grams every 8 hours for those 12 years and older. And piperacillin has a half-life of 36 to 72 minutes. There are a few brand name piperacillin antibiotics out there, and those include Piperacillin and Zosyn. Piperacillin is piperacillin sodium. It's a piperacillin systemic, which means that it just includes piperacillin and sodium. It does not include the tazobactam that we talked about earlier. It's part of a class of drugs known as pseudomonal penicillins, which are used to treat diseases caused by bacteria in the Pseudomonas genus. And it is an intramuscular injection that's given over the course of 7 to 10 days. Zosyn is a piperacillin-tazobactam combo antibiotic. The tazobactam helps protect piperacillin from enzymatic degradation by beta-lactamases, and this helps to extend the spectrum of activity of the antibiotic and prevent bacterial overgrowth. And it is also given over a period of 7 to 10 days, except Zosyn is given via IV infusion for about 30 minutes. This is a diagram of piperacillin inside the cell. Piperacillin irreversibly binds to the enzyme penicillin-binding proteins, unique to bacterial organisms located on the inner membrane of the bacterial cell wall. It's able to accomplish this due to the shared stereochemistry with the other substrates that may bind to those enzymes. More specifically, piperacillin is able to bind to the serine residues at the active site through a covalent complex. This prevents other substrates from binding to it and ultimately interferes with the cross-linking of peptidoglycan chains needed for bacterial cell wall strength and rigidity. Cell wall biosynthesis is interrupted, leading to a weakened cell wall. The release of autolysins, an autolytic enzyme, mediates cell lysis. Piperacillin also has in vitro activity against gram-positive and gram-negative aerobic and anaerobic bacteria. This means that piperacillin outside a living organism in tools like test tubes and culture dishes still demonstrates its ability to degrade and inhibit bacteria. Before taking piperacillin, patients allergic to piperacillin or any other penicillin antibiotic, tazobactam, or a cephalosporin antibiotic should not take piperacillin. Patients should inform their doctor if they have ever had kidney disease, a bleeding or blood clotting disorder, an electrolyte imbalance, cystic fibrosis, any allergy, or if they are on a low-salt diet. There's no severe drug interactions with piperacillin, but there are some moderate drug interactions, such as interactions with warfarin, heparin, antithrombin alpha, azithromycin, doxycycline, and other drugs. In general, it's important for patients to talk with their doctor or pharmacist about possible drug interactions with any medications that they may already be taking.
Here's a list of some serious side effects that can occur from taking piperacillin, but they're not very common. First, any signs of an allergic reaction, such as a rash, hives, itching, red, swollen, blistered, or peeling skin, with or without a fever, wheezing, tightness in the chest or throat, trouble breathing, swallowing, or talking, unusual hoarseness, or swelling of the mouth, face, lips, tongue, or throat, unexplained bruising or bleeding, fever or chills, or seizures. Diarrhea is common when taking antibiotics. However, the severe form of C. diff associated diarrhea can develop, and that can lead to colitis. And after several months, that is a more deadly bowel problem. This is very rare, but patients should still notify their doctor if they have stomach pain, cramps, or loose, watery, or bloody stools, just to make sure that that's not happening.
When this antibiotic is taken over prolonged periods of time, there could be other adverse effects associated with several hematological disorders. These affect the white blood cell counts. Leukopenia is decreased leukocyte count. Neutropenia is decreased neutrophil count, and eosinophilia is increased eosinophil counts. The chance of development is increased in the younger population, and they usually indicate an allergic reaction to the antibiotic. There have been clinical case studies conducted to assess the safety and efficiency of piperacillin. It treated patients with moderate to severe infections caused by the susceptible bacteria. The study, done with 485 patients, received a daily dose of 13 grams for about 11 days. It treated 562 infections caused by over 885 organisms. In 90% of the patients, they were either cured or showed clinical improvement. This means that 506 out of 562 of the infections were successfully treated. 80% of the causative agents were eliminated. Patients didn't really have many side effects, but 4% had a hypersensitivity reaction, 4% had phlebitis, which is inflammation of a vein, 3% had gastrointestinal intolerance, 1% was in pain, and 1% had other reactions. But overall, this was a good indication that piperacillin is safe and effective for treating a broad range of pathogens. Antibiotic resistance has been a really big problem lately, so basically bacteria that take the back roads get the good stuff taken into them, as shown in this picture, and they become untouchable. No, they actually don't take the back roads. Well, maybe they do, I'm not really sure. But they change in response to the antibiotics if the antibiotics are overused or don't kill the bacteria completely. So this leads them to being able to grow and multiply, and the antibiotic won't work anymore. There is a specific type of antibiotic resistance in piperacillin. It's called heteroresistance. So this is when a phenotype in the bacterial isolate contains subpopulations of cells with increased antibiotic resistance when compared to the main susceptible population. But it's usually lost after multiple generations in absence of the antibiotic because they don't need to make and amplify the extra protein to be resistant, and there's less environmental pressure. There's a specific phenotype of E. coli and Klebsiella pneumonia that are resistant. The resistance mechanism is associated with this phenotype has been identified as the hyperproduction of the B-lactamase TEM. The gene amplification has been linked to the cause of a temporary antibiotic resistance seen in the subpopulation of bacteria. While the mechanism of amplification of the gene is not well known, recent studies have found that the amplified BLA-TEM has been co-located on a segment of DNA containing other antibiotic-resistant genes. Thank you for making it to the end of our presentation. Here are our sources.